So when you do a hand exam with an injury, you should check sensation. So you'll want to take your finger and run it along the side of the patient's finger on each corner. Can you feel that?
Yes.
Okay. And then can you feel that
Yes.
here? And feel that here?
Yes.
And feel that here?
Yes.
So then you know that if the sensation's intact, then there shouldn't be any nerve injury. You can do capillary refill, so less than 2 seconds, that would be normal. If you're going to suspect that there's a injury at the DEIP or the PIP, you can isolate the finger. So I usually will hold the finger this way, or I'll put my finger under here. Let me bend your finger down, and then I want you to push up against me. So see, she's got normal extension at the DIP, and then curl your finger down, and she's got normal flexion against resistance in both extension and flexion. And then we'll do the same thing for the PIP. So I'm going to let me bend your finger down, and I'm pushing here rather than out here, and go ahead and extend for me. And so she has normal strength there, and then push down, and so she's got normal strength there. So we can assume that the extension and flexion mechanisms are intact. The only time you can sometimes get fooled is if there's a capsule injury here. Then what will happen is they'll still have some extension, but it'll be a weak extension. And what you're supposed to be able to find is go ahead and relax the finger down. Now push up against me and just hold it, not so hard, and then keep a little bit of tension against there. But this should still move a little bit, and then that means that it's primarily the capsule that's doing the extension. If this is tight here and you can't get any flexion, then the extension is coming from collateral ligaments. If the person's had a dislocation or a bad sprain, you can do radial deviation. So you can put some pressure just here on the PIP and then push over. You can do ulnar deviation, and then you can do a drawer test where you can pull up and check for stability there. And that's my hand exam.